Well, as we have mentioned, Israeli strikes continue and the healthcare system in Gaza is on its knees. For more on this, I'm joined by Ahmad Al-Fara. He is the director of the maternity and paediatrics department at Nasser Hospital in Han Yunis. Thank you very much indeed for your time. Look, for months and longer than that, we've been hearing that the healthcare system is on its knees. It is on its last legs. Medics and doctors are exhausted from the care that they are having to give. How are facilities coping, and how are the people who work in them still managing to continue to operate?
Okay, thank you, my friend. I'll talk about my morning meeting today. We visited all the section of our hospital, especially the neonatal ICU. When we visited the neonatal ICU, we get inside and we were shocked about the situation there. We have the open system. The open system is just prepared for treatment of neonate and take blood sampling and try to deal with the case and evacuate it for another neonate. We have 6 cases which were put there, and there is no places for these neonates. One of them is on mechanical ventilation, 2 are on oxygen, 3 are under observation. So the situation was very, very, very critical and very catastrophic. When we get outside in the baby-friendly room, we saw a lot of cases who were neonate and premature baby. Their mothers are on the floor. They just on mattresses, and some of them without mattresses. This is the most overcrowding condition that we have ever seen in Nasser Medical Complex. We are talking about nearly 10 folds about the occupancy of the hospital in comparison before. We are talking about 1,000 visits within 24 hours for the pediatric department. We used to see just 100. So the numbers are huge numbers, and the facilities are nearly consumed. We should talk about the lost normal saline, lost ringer lactate, IV fluids, antibiotics, even a nebulizer. Today while we are talking with the media in neonatal ICU, we need some nebulizer. We nowadays have an outbreak of acute bronchiolitis due to respiratory syncytial virus, and we need a nebulizer and oxygen. I saw, and the media saw with me, that there is 3 or 4 neonates are sharing one source of oxygen. That means that one neonate is getting oxygen for 20 minutes, and then they take the oxygen from him and give it for the another neonate, and then for the another neonate, and then come back. This is unbelievable that a neonate who needs oxygen and can't take that oxygen with good quantity and with constant supply. This is the situation.
So clearly, everything is in short supply. Ahmad, are you having to perform operations on a regular basis without anaesthetic?
This happened in Gaza City, but in the south, in Khan Yunis, in Nasser Medical Complex, up till now, we are using anesthesia. But in the Gaza City, they are sometimes dealing with this problem without anesthesia. But we have shortage also of the instrument of the operation. If we visited the orthopedic section, the internal fixation, the external fixation, the intramedullary screw, all the equipment for surgery are lost nowadays. So sometimes the patient is available, the doctor is available, the theater is available, but the instruments are not available. So they postpone the surgery, and this is make the patient to be prone for more complication and for more catastrophic situation. Sometimes we have lack of selective antibiotics, and in the last 3 months we discovered a lot of bacteria and the strains of bacteria which is very resistant to antibiotic. So all the ones that we are dealing with it are very serious, and sometimes the doctors make a decision to make amputation for the legs of the patient, while if good antibiotic were available, I think he will survive without amputation.
Okay, so the loss of limbs, of course, continues. And a more general question. Of course, there have been large numbers of casualties since the beginning of this war, and that's been going on for nearly 2 years now. But have you noticed an increase in the amount of people coming in for treatment since the ground offensive began in Gaza City? Because as a result of that, hundreds of thousands of people have had to move south towards you.
As I mentioned before, my friend, that we already are complaining from overcrowding in Nasser Medical Complex. We estimated that nearly 1,300 patients nowadays are admitted in Nasser Medical Complex. But in meanwhile, as you can see with that report, this report, that sometimes we have mass casualty in Khan Yunis city, sometimes from distribution aid, sometimes targeting against evacuated center, against tents. So we still facing and challenging and treated cases who are coming from mass casualty, but the total capacity and the total load on the reception room, either in the pediatric department or in the adult, or in maternity, or in the surgical department, all of them, they are occupied. As you can see on the TV now, we have 3 unit in the open system. The open system should just have 1 unit and be removed. This situation is unbelievable. This has increased the infection. This has increased the confusion of the staff about dealing with that number of cases. As you can see, the patients are on the corridor. You can imagine that a mother with her in unit who's just 5 or 6 days complaining from respiratory distress and unable to respirate usually, and he's on the mattress or without mattress on the floor or on the ground. This is unbelievable. This is total punishment for the Palestinian people, including the babies, and even the fetus in the womb are punished by this war.
And just finally, and specifically to your department, maternity and paediatrics, I mean, what are expectant mothers saying to you when they come to hospital? Young, maybe some older, experienced mothers. What are they telling you when they arrive about bringing a child into this world in the situation that people are living in Gaza right now?
Actually, I'll talk frankly, and believe me that a woman nowadays, when she got that she's pregnant, she feeling sad and she's not feeling happy, because she know that she will suffer a lot. She suffer a lot in the evacuation center. She suffer a lot to have a good water. She suffer a lot with follow up for that pregnancy. She suffer from unavailability of vitamins and something minerals like folic acid for that pregnancy. She afraid in the tent. She afraid. She's under stress. She know that there is increased number of intrauterine growth retardation, increased number of prematurity. So she always under stress. Unfortunately, she have one of 3 or 4 possibilities. First possibility is threatened abortion, and this has happened too much especially in evacuated women from Gaza to Khan Yunis. We recorded nearly 6 cases of women who were prone to abortion due to stress and work and a lot of exhausted after coming, some of them coming walking from Gaza to Khan Yunis city. And also she has the possibility to have a baby with a small size, we called it intrauterine growth retardation. Also, she have the possibility to have a premature baby. Also, she has the possibility to have malformed baby with congenital malformation. So she's suffering, and even when she has on labor and time for delivery, she's afraid that this hour is coming at night and no transport to the hospital. Sometimes she have to be delivered in the tent or in her way to the hospital. While she coming on walking to the hospital, we saw a lot of cases that women lost their babies while they are coming to the hospital for delivery where they were walking. So it is horrible. Even when she in good general condition and the baby is well, she's afraid that she will come back to the tent again and she will ask about water. She will ask about feeding for herself. She will ask about feeding for her baby. So it is a catastrophic situation affecting her and affecting her baby.
Yeah, Doctor, it's clear that you and your colleagues are overwhelmed. So we do thank you very much indeed for taking the time to speak to us here on TRT World. Thank you.